Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our video today. So we're a little bit different this time. We've done fungal infection recently, and lots of people ask the question about, what does it look like when people come back? And so I thought what we'd do, we had a patient who came through the clinic with an outer ear infection. So we've seen this patient on 3 occasions. This is the first time I've seen this patient. You can see we've got a very swollen ear canal. The canal walls are really puffy. They're also very red, aggravated, inflamed. Very wet, sticky, thick discharge in the ear as well, which is a mixture of the wax but also infected debris as well in here. So what we're going to show over this video is the 3 visits the patient has. So it'll give you an idea of the progression of the treatment of the ear infection. So for this one, the main job today, we know the patient's got an infection, so my main job here is just to clear as much of this debris as we possibly can, so that when the patient is using, for an outer ear infection, it's usually a topical treatment. So when the patient uses the spray to calm this skin down and to treat this infection, it means that the spray itself can get to the affected skin underneath. So I'm just taking away the sticky, thicker debris here. You can see there's not a great deal of room to work in here. That's actually a fine end we have on the end of the suction there. So you can see that it's not, there's not a great deal of space in there whatsoever. So just trying to work as gently as we can, because obviously if you can imagine, canal walls are sensitive anyway. If you aggravate them and inflame them like this, they are ultra sensitive. So we just try as best I can to avoid touching those canal walls. So this is the patient's second visit, so this is 10 days later. So the patients have treatment in here now for 10 days. It looks very wet. They've been using a spray treatment in here, so we've now got a mixture of the spray treatment, the infected debris, and any sort of more liquid wax. So I can just try to uncover the canal walls first of all, so we can get a look and see what the canal walls are looking like. Now as we start to clear, you can see there's some pinkness there, not looking quite as red as it did in the last video, so it is starting to take an effect. But what you'll see now as we start stripping this away is you'll start to see lots of dead skin as well, where the top layer, see where it's peeling away there, you've got this whiter layer underneath. If you imagine the skin is wet constantly, then you're going to get this whiteness. If you ever had your hands in water for a long period of time, you get this kind of white layer to the top of your skin. That's similar to what we're seeing here. So we're just stripping this away at the moment, very gently. We can see the ear canal, some of the swelling's gone down, because this is the standard size ulnar tube we have in the ear canal at the moment. So you can see it gives us a little bit more room. I do have 2 bits of news for everyone as well. So I'm going to wait till a bit later on to tell you those 2 things. But we're just going to keep just plugging at this a moment. You can start to see the eardrum now. So we're going to go in with a fine end just to get that a little bit deeper in, because we're going to be working a little bit closer to the eardrum. So you can see we're lifting this liquid debris off the base of the canal here. Looking at the canal walls, I know this patient's going to have to come back in and see us again. What we do here is, if a patient comes through with this type of problem where there's an infection, we automatically follow them up following their treatment. Now, a lot of places don't. We like to. I'll explain why when you see the last visit in for the patient. It's a bit easier to explain, to be able to see what we're talking about. But what I want you to bear in mind with this one, see how wet this debris is at the moment. It's covered the eardrum. So we're just trying to take some of this looser skin and debris off the canal walls here. So it's completely covered the eardrum with a very wet material. You can see it's very thick. As we get a little bit closer, see it's starting to peel away there at the top of the canal. There we go. What we're going to want to try and do is uncover this eardrum as much as I possibly can here, because obviously the eardrum is skin, so it's going to get aggravated with this infection as well. So we want the treatment to be able to get down to that layer as well. Now, when it's all blocked up and thick with debris like this is, that the treatment can't get down to where it needs to. So you can see we're just trying to clear a little bit off. You'll see a little bit of flexion there to the eardrum, so we're going to be really careful here. Just taking as much of this. You can see it it's thick. We can see the blue of the eardrum underneath, which is great because it shows me the eardrum hasn't been affected too much. We're not getting a really red puffiness to the eardrum, which you can do with some of these sort of certainly outer ear infections. The term for an outer ear infection is otitis externa, which just means any kind of aggravation or irritation to the outer part of the ear. You can see we've still got some quite liquid, thick debris deeper in. Just taking that away. Okay, first bit of news. I am on leave next week, so there will be no videos next week. I'm sorry, but I am then back to normal the following week. This is the last visit, so what we can see now, there's the eardrum, so you can see the swelling's gone down, the skin's looking more normal, but see all that liquid debris we did have on the eardrum is now hardened, so it's formed a thick plate, also coating the canal walls. Now this is the reason I like to have patients back in. Now this patient was explaining that they felt much better in their ears, there was no irritation there now, it didn't feel as squelchy, which is quite a common term that people normally use with an outer ear infection, but they did feel their hearing was still quite muffled. Now the reason for that is that liquid debris that's been sitting all over everything is now hardened up, so it's actually thickened and formed a very thin plate or layer over the eardrum, which has hardened itself. So what that means then is it's very difficult to get the full range of movement to the eardrum. So this is why I like to follow these patients back up, is because then we can go back in, and as you can see here, all of that infected debris, all of the treatment that's been going into these ears is now dried into these much harder pieces. So we've introduced a little bit of olive oil in here, which is going to help us to peel this off the canal walls. So while you're just watching that, the second bit of news we have for you is we have another audiologist starting in a few more weeks' time, which is absolutely fantastic. We're super excited. It means that it's going to free us up a little bit to be able to concentrate a lot more on things like YouTube and our social media and stuff like that. So thank you everybody for being so understanding and bearing with us over the last few months. It's gone crazy busy here, which is fantastic, but does mean with somebody else on board as well, covering some of the suctions, it's going to help us to really concentrate and get more content out there for you guys as well. So you can see we're starting to peel this away, and it's starting to come away from the bottom of the canal. These are one of my favorite ones to do. I love peels. They're the most demanding ones to do, but they are by far the most satisfying ones I find to be able to do. There's something really nice about them. It takes a really steady hand to do them, but they're one of my favorite ones to do. So we're just taking some more of this debris away. You can see as we're uncovering the skin in the ear canal, see it's a far more healthy beige color. We've just got this little bit of debris here at the top of the canal. Now normally when I'm doing a peel like this, you normally pull down as far as you can. This patient has a more difficult canal to work in, because you can see rather than it being a circular shape, we're more of an oval tilted onto its side, so you get a lot of kind of top right to bottom left movement, but not a great deal up and down, which means that when you're peeling from the roof of the canal, the sort of like the attic region is what we like to call it, what you end up with then is you don't have a lot of space, so we have to kind of peel across to the left, then back across from left to right, then back across from right to left. So we're using the crocodile forceps here just to see if we can do a gentle peel down and across. There we are, that's taken that away, because it's easier to pull that backwards motion, whereas the suction wouldn't have held onto it as tight enough for us to be able to do that. Now we're lifting the bottom section here, so you can see we're working slowly down to the eardrum. See how much healthier that skin looks though? There's a slight pinkness there, yes there is. This has been sat on top of it, so it's been not aggravating as such, but it hasn't got that kind of normal beige appearance. But you can see just how hard and thick this is. What I'm trying to do here is I'm trying to look for a flatter section of that wax so that I can get a really good grip on, but I'm struggling a bit to get that really good grip. So what I'm going to use is the crocodile forceps again. It's not the easiest piece to get a grip on because it's sideways on and we haven't got a great deal of room to open the forceps up in here. It's difficult to get around to the front end of this wax. And debris, sorry, I should say. So I'm trying to pinch it in the middle if we can to fold the top back in so we can get it. There we are. Now we've got the grip. I want to get this piece because it's quite a large piece. I just want to get this out of the way. There we go. And you can see we've got the beginnings now of what's coming down onto the eardrum. So we're going to peel this across. You can see we've got more room if I peel from top right to bottom left. There you go. See, it's starting to peel away now. And so that's the top section coming away. We need to get this set. You can see how brown that eardrum looks there. It's completely caked. And as we peel this away, you can see it's starting to come away from the eardrum, starting to come away from the canal walls. We're getting that pinker skin look there at the top underneath, flattening it out, trying to get a good grip on that back section there, peeling across and out. There we go. Now when you take a look at the eardrum, can you see the bluer colour starting to come through now? You'll see, I'm just going to work on this flap that's about halfway up here. But you'll see that bluer tinge coming through now. So we're starting to break this away. What I'm doing here, it's such a fine piece. I can't press into it because it's on the eardrum. So what I'm going to have to do is flick it out so that it's facing directly towards the endoscope. And that means then if I can get it pretty much straight on, I can get the crocodile forceps on it to take that away. There, that will, oh, I'd flick back. Difficult with the suction because you'll pull it so far and then it'll flip back into place. Got it straight there. So what I'm looking at, you'll see what I mean by getting the crocodile forceps. Now it's pointing straight towards the endoscope. We're straight on with the forceps. We can get a good grip peeling away. There we go. You can see that chunk. So that's taking it off the top of the eardrum there now. Okay, this is where it gets really delicate. You can see I'm just taking a little bit. What we've got here, the debris come away with a very thin layer coming away. So we have to press into the canal wall. Now this is really sensitive. So I always explain what I'm going to do before I see the pet. And they are going to experience a bit of a pinching, scratching. I'm trying to lift here off that canal wall. You'll see why. Because if I can get a lift there, see that top section and bottom section are connected together. We can get a good... Oh, just flip back into place. We can get a good movement there. You can see the olive oil working down behind it now. But look what's happened. It's sheared away. And can you see that piece is flicked back? So there is a trick for doing this. What I'm going to do is I'm going to use the suction, not the end of the suction tube, to lift it. Watch what happens here. You'll see it flick up with the suction. There. See it starting to lift from the canal wall? There. Got it. So we're not touching the canal wall at all. We're using the suction to bring that up towards the end of the tube. We can get a good grip on the back end of this now. Really trying to peel from left to right now across here. You can see where the olive oil's gone in. It's starting to whip behind. You've got to remember this is so thin that it's quite common for it to shear there. Now we've exposed that left-hand side of the drum. I'm going to try and do the same trick now with the suction at the bottom here. Try and lift it, but I think this is too far back. We're not going to get a good lift here. We're going to have to push into the canal wall a little bit. Always got to be very careful. Canal walls can bleed if you push too far into them. There we go. We've got the lift we wanted. Just got a grip on that edge. Peeling across to the right side. Oh, sorry, I'm shouting at the microphone. There we go. And then we're going to bring this section back now. There we go. Good peel there from the canal wall. And you know, the patient, fair play. They sat through so much to go through this, in fairness to them. But by this point, they kind of... We were going to try and take this last little piece if we could away, but patient had enough by that point. So this is what we removed, and this was just from the last visit. So this is all those skin peels. You can see quite a bit there was coating that canal wall. Just after this, I'll show you the difference from when they first came in, which should pop up in a second. There we are. So that's what it looked like when they first came in, and that was the first visit. And then that's what they look like by the time. You can see the difference there in the canal. Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already and you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. And as always, guys, until the next time, take care.